Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new TEAM therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda.
Hello, David, and welcome to all of our listeners around the country, around the world, and throughout the galaxy. This is the Feeling Good podcast, and we are at episode 495. And today we have one of our very favorite podcast guests, Thai-An Truong. And as most people who have listened to this podcast already know, that Thai-An lives and works in Oklahoma. Her therapy practice is called Lasting Change Therapy. She's a level 5 TEAM-CBT practitioner. She's an extraordinarily fantastic trainer and therapist. She's a licensed alcohol and drug counselor, and she's a licensed professional counselor, and she's absolutely brilliant, and we're so happy to have you here, Thai-An.
I'm so grateful to be back. Thank you so much for all of your kind words. Such an honor to connect with both of you again.
Nice to have you. And today's topic is on codependency and how you use TEAM-CBT methods and techniques, and the TEAM-CBT structure, including addressing resistance with people who are struggling with codependency. Mm-hmm. So why don't I turn it over to you and ask you to share what is codependency, or anything else you want to start off talking about?
Yeah, it's a great question, where this term sometimes now feels a bit controversial for people, where people just don't want to be labeled as codependent, where it has this negative connotation. But I think it's helpful to just have an awareness of a behavioral pattern. And I was introduced to the idea of codependency actually in my very first job postgraduate school, which was a residential treatment center for women getting off of drugs and alcohol. They had lost custody of their children, and we had a therapy group called Codependency. And in that setting, we defined codependency as just a habit of just getting into relationships that aren't the best for you, and it feels addictive, and it feels almost like another substance, like it's their meth or their alcohol. So they're in this relationship, and it feels one-sided. It feels unhealthy. They may give a lot to that person. They may really want to try to help that person, but that person may end up just using them, hurting them. It feels really one-sided. On occasion, they may receive some nuggets of like, hey, I love you, I care about you, and that seems to help to resolve everything. And so in this group setting, we conceptualize codependency as almost like a relationship addiction. Mm-hmm. So that's one way of defining it. The more official term codependency was coined by Melody Beattie, so I want to give her full credit. And her definition of codependency, she says, it's letting another person's behavior affect you and becoming obsessed with controlling that person's behavior. So really seeing it as that habit in a relationship as well. In codependent relationships, she says, one often loses one's own life while trying to help the other person. And so it's a pattern rooted in often family dysfunction and addiction, leading to neglecting oneself and managing one's priorities. It's almost like prioritizing their needs. I've also heard it coined or just defined as like the need to be needed. And so when someone really needs me, there's something about that fills me up.
And then is part of that a fear of being rejected by them, or a fear of being alone or abandoned?
Yeah, I think it could be unique depending on the person. We see this outward pattern, right, of someone just continues to get into these unhealthy relationships. And I have a case example of a professional woman who's attractive, smart, and she just continues to get in relationships with men. Like she got out of an abusive relationship and got into another one with a man who initially felt charming and then found out like he really had a major drinking problem. And so for her specifically, I think we just have to look at their learning history, their own reasons, and their own specific thoughts. But for her, it was around things like, I don't deserve any better, but also it feels like really good when he's saying like, oh, you're the only person who sees me. You're the only person who's really there for me. And so there's something that felt really good and rewarding for her about that. So depending on the person, I think some may fear rejection. Yeah.
In your example with her, I know people that sometimes with women I've worked with, they've thought, I won't find anyone else. So I have to really work hard on this relationship because no one else will ever get me again.
Yeah, that's a great example. And I think the brilliance of Team CBT is we get to understand specifically this person's learning schema and their thoughts when we dive into the habits and addiction log on what are the tempting thoughts that keep you in these relationships. But also there's probably a mood work aspect too, right? Like, is there also then a thought of like, this is the only person I can have. I won't be able to find anyone else. Maybe that person has also almost brainwashed them and says, I'm the only person who cares about you. Or they think they're worthless. There's some wounding, it seems like, that seems to continue to drive it. And
so this is the extreme example of the fear of being alone and the idea that you need love to feel happy and fulfilled, and a kind of a obsessive drive to make a relationship work when it's clearly not working. I come across this sometimes. One of my favorite TV shows is The First 48 Hours, which is actual homicide investigations, and they'll occasionally have this pattern. And my understanding, just from the TV show, is that the murder component often gets into it at the point that the woman decides to leave. But I'm not sure that that's consistent with your understanding as well.
Yeah, I'm hearing like when it's an abusive relationship, there is higher risk for their well-being, right, when they decide to leave. And I think codependency goes into, like, sometimes it's getting into abusive relationships, but also it could just be getting into unhealthy one-sided relationships where there may not even be that threat of abuse, but there's something about this dynamic that feels like it's hard to let go of. It keeps repeating the cycle. And so for my client, her kids even asked her, like, Mom, what are you doing?
Oh, her kids are noticing too?
Yeah. She talked about how embarrassing it is realizing like this man is drinking more than she had anticipated. Like at first they were having fun, but it gets to the point where he's embarrassing her. And when they had a family get together, there's not a threat of like him leaving. He wasn't abusing her, hurting her in any way, but it was just this pattern of I get out of one unhealthy relationship and I get into another. And diving into her habits and addiction log, there was something really rewarding around moments when he's like, you really get me. You're the only one who understands, or, because of you, I'm really going to work on myself and change, even though the cycle just keeps on coming back.
Thai-An, did she also feel a responsibility for trying to fix the men that she's in a relationship with?
Yeah, I mean, I think the definition of codependency, when they talk about like that need to be needed, there's also this space of like, I need to fix them. I need to control them. I need to change them. And there's something in that about taking on that responsibility. There's some discussion about maybe it could be rooted in trauma or something in family of origin that they're trying to fix or trying to gain empowerment over a really helpless situation.
And then just piggybacking on what David said, that it sounds like there's some self-defeating beliefs woven throughout all of these thoughts about I can't be happy unless I have love, or I can't be alone, or maybe even Superwoman.
Yeah.
I mean, it sounds like a couple beliefs working hand in hand, although I don't claim great expertise, but the love addiction is certainly one. If it's a woman, relating to this guy who's just getting drunker and drunker and not really being there for her, but then also this compulsion to help, and of course which is another kind of addiction to my way of thinking. And I've often said that most therapists, I believe, have codependency and have an addiction to helping their patients, and that is the cause of almost all therapeutic failure, because the therapist won't make the patient accountable. And there could be some other reasons as well, but it's something that I get irritated about, and this compulsion to help, and you see it in parents with their children too, who have a compulsion to control and help their children, as opposed to, Dr. Taylor Chesney was on the show recently and did a beautiful job. She's another one of our favorite guests, Thai-An, along with yourself. And she was talking about just parents to form a relationship with the kid. Right. Not to be judging them and telling them what to do, and if they get involved with sexting or some bullying or some kind of negative behaviors, to resist the urge to try to control them. And the problem isn't with their cell phones or with the social media, but with the parents not really forming a meaningful relationship with them. So I think that, I see that kind of codependent thing all over the place.
Yeah. I think you make such a great point, and I think there's even two layers to this that's important for us to address, where if you see this dynamic in a client, it's really important to not just try to jump in and fix them, right? Like,
is it okay to help them?
The key to what you is it okay to help them?
Yeah. I can help.
Right. To try to help without them wanting help on this issue. That's what I saw in residential treatment, where then, of course, you would see then the clients just having a lot of resistance.
The help forces them to resist.
Exactly. So they're trying to help their alcoholic partner change, and then there's a lot of resistance there. And then if the therapist comes in and tries to, quote unquote, help the client, we will see a lot of resistance. And so it's really important in this, to really clarify, do you want help in this pattern? And it's only when I hear them identify that I'm tired of this pattern, I'm ready to change this, I don't know how, that when we do specificity, that they identified this as something they want to change, will we have any effectiveness? Otherwise, what I've seen is the therapist may be coming from a good place and wanting to help, but the client starts to feel shame, because the therapist may say things like, you're just in this addictive pattern. You're just hurting yourself in this relationship. It doesn't help you. I've heard the therapists in the groups may even say things like, what would you want for your child? Would you want this for your child, for them to be in this kind of relationship or dynamic? And then it just feels like that helping becomes shaming of that behavior.
Yeah. Right? Give us the sentences that are shaming, because I wrote down the therapist may trigger shame when trying to help, but say what are the statements that you're going to make to your patients?
Yeah, I think some statements a therapist may make that could inadvertently create shame are can't, this is really unhealthy, and look at this addictive pattern. What would you want for your kids? Do you want them to be in this situation? And so they're trying to shed insight or wisdom But then that could actually just create defensiveness and shame for the client.
Yeah.
I've even heard them say things like, you're just trading your addiction to alcohol or meth to this man that's using you or hurting you.
Yeah.
And so even if there's truth in it, it feels really shaming, right? Instead of working to understand, why is this habit here?
Yeah. Mm-hmm. I love what you're saying here. Everything you're saying seems great, but things are kind of coming together a little in my mind right now.
Mm-hmm.
Rant on, Thai-An. Tell us more good stuff about the things that don't work if you're a therapist, and then the things that might work. The direction we have to go into to get some. So if we're going to stop compulsively trying to help, then what is option B?
Yeah. I think option B is TEAM-CBT. And I've just is TEAM-CBT.
Yeah.
And I've seen it to just be so much more effective when we first just go through the process of really empathizing. So we're doing measurement and testing around their mood, because even if they don't identify first, I want to change this pattern, they're really often anxious, depressed, worried about the person, angry. And we can capture that, and we can capture those symptoms and understand the impact of this behavior with codependency. Right?
So they're going to have many on the testing. They're going to have anger, along with anxiety and depression, and guilt and shame, and inadequacy and hopelessness, and the whole everything, all the negative feelings, right?
Exactly. Yeah. I often see all of those marked, and especially a lot of resentment, anger, hurt in this process.
And then at step 2, which would be TEAM, testing is step 1, empathy is step 2. What are the do's and do nots there?
Yeah, I think empathy is so crucial, where we could set aside our lens of trying to shed wisdom or trying to help, and just really sit with understanding. What has it been like for you? Let me connect with the anger that's coming up. Let me connect with how much this hurts. Let me connect with, I'm imagining you're feeling pretty powerless in this situation, right? And so our empathy tools, instead of shaming their client for their behavior, it's working to understand it, working to see where it's coming from. And even that stroking, I think it helps to see, like, there's even positive intentions, like, I'm really desperate to save this person from their addiction, or it comes from a space where I just really care about them.
Yeah. Have you seen our my preaching slide?
Preaching slide?
Yeah. Do not preach, PREACH. During the empathy phase, the do nots. And the P would be problem solve, R would be rescue, E would be psychoeducation. Let's see, A would be, I can't remember, but it gets down to, C is cheerleading, H is helping. I'll try to put it in the show notes, but it's kind of cool. It's all these things that therapists do. Yeah, it's a.
And it sounds like this is stuff that people in relationships who are codependent also do. Cheerleading and helping and rescuing and problem solving.
Yeah.
Right. We'll see that double dynamic. If the therapist is doing that, we're engaging in codependency with the client. And if the client's doing that with the person they're trying to save, it doesn't work.
I have a question for you, Thai-An and Rhonda. Sometimes I say what you want to do at empathy is just encourage them to vent their negative thoughts and feelings without doing anything to help. You want to go with them to the gates of hell and be with them as they're experiencing their pain and resist the urge to do anything about it. And that's the zero technique. You give them zero and zero in on what they're thinking and feeling. And here's my question for the two of you. When I say that, do you think anyone's ever heard it?
Oh, yeah.
You do?
Uh-huh.
Rhonda?
I think it's super powerful.
Mm-hmm.
Because I like both parts of it. Well, I don't, Thai-An, I should let you answer because you're a guest.
I was actually trying to understand the question you said. Have people actually heard it, as in have they heard someone just actually being there with them versus the fixing statements?
But have they, or do you mean, or have they incorporated that in their work? Right, David?
Yeah, yes. Do you think the therapists hear that or just go right on being codependent? That was my question.
Oh, I see.
Well, it depends on how much of their own personal work they've done.
Yeah.
It's not easy. I mean, truly, it's taken us, I think, a lot of training, a lot of practice to soften or set aside parts of us that want to come in. And because I can even think of this client and I can think like a part of me wanted to shake her and be like, oh, you're brilliant, you're beautiful, you're intelligent. And you're with this man who's just, I mean, everyone's looking at them and being like, what are you doing? Including your own children, right? But
well, what you need to do, I'll show you how to improve that, Thai-An. When you're talking like that, and then just say, but I can help.
That's great. But David, you're making a really good point, because when I teach about the 5 secrets, the zero technique, people do is really the hardest for people to learn, because they want to interpret, they want to add. They're not zeroing in on what it is the person's saying.
But how much of that is a lack of technical skill, and how much of that is a lack of motivation?
Yeah,
that's a good question.
I had a resident. He was a brilliant guy, and he was publishing regularly in the world's top scientific journals, in addition to his psychiatric residency. But he couldn't seem to let go of this idea that he was in control of his patients. He was the expert. He was going to tell them what to do. And I worked with him for 2 years. And finally, after 2 years, I decided in this lifetime, he'll keep doing that. And of course, he'll get promoted too. He'll end up a department chairman of psychiatry at some prestigious place. But that's.
Why do you think that?
Because that's the way the system works. As the Buddha said 2,500 years ago, psychiatrists are stupid assholes. Unless you're a psychiatrist listening to the show, and then you're the delightful exception.
Yes, of course.
But no, that just a compulsion that people get into. It's an addiction, and continue directing us on our A and stuff, Thai-An.
Absolutely. And you make a great point. It feels addictive, right? Is there motivation there to actually change? Is it just a skills deficit? And a lot of times it's not.
Yeah.
And so we have to look at motivation, especially you're working with this client. And so empathy just allows them to really feel like you're there with them, you're present, you're hearing them, you're making space for all of their pain. And then that's when we invite them to do some work if they want to, right? So the addressing resistance or agenda setting is really key.
Now, would you use a straightforward invitation or a paradoxical invitation step going from empathy into the agenda setting?
Yeah, I think it just depends on the level of resistance. Usually with habits, a paradoxical one feels helpful. But right now, the initial invitation, I often just ask, is this a good time for us to move forward with working on one of the areas that you're wanting to change? Or is there more you want to share with me? Where it's just an invitation to let them know there's more we can do. There's active work we can do. I feel like that's really hopeful. And then once they identify, like, oh, I actually really want to work on this habit. Because a lot of times they'll share, like, I want to work on depression or anxiety or resentment toward my partner, or how can I even change my partner? Can you help me with that? Right?
Yeah.
And that's when we would have to do, I feel like, the paradoxical agenda setting process, or even the invitation of, I feel like, we could do some good work on your mood. And when there's this habit of continuing to engage in these really hurtful relationships, it feels challenging to be effective with your mood. And I bet there's a part of you that it may be hard to actually focus on wanting to change getting into these kinds of relationships.
Can you give me some tips on how I can change my partner? That's what I really need today.
Yeah. Yeah. And that would be so great, right? If we could really have tools in the world to change the other person, that would change your life.
So where's the art come in? How do you do it, Thai-An? That's somebody who's kind of fixated on, I'm going to fix the other person.
Yeah. And I'd love to share with you tools that can help you in these patterns when you're feeling so stuck and resentful. And I'm hearing that pattern's driving the anxiety, the worrying about that other person, the depression. If you're willing and open to some of the tools I have that can help you change the patterns that are creating a lot of suffering, I'd love to share them with you, but I imagine that's challenging to want to buy into.
And then would you go in the direction of a relationship journal or like what you were talking about earlier, Rhonda, some double standard for codependency type technique that you've developed, Thai-An, or what?
I've actually conceptualized this as habits and addiction.
Right, exactly.
So when I've worked with this process and I've seen it's been a repeated pattern for this person, I would share with them. So when they're interested, we would look at what's your motivation to change this? Because I'm willing to bet when this pattern shifts, it will help mood. It will help the resentment if you're willing to solely look at applying the tools to shifting yourself and your patterns, right? And when they're willing to do that and there's motivation, I actually conceptualize it as a habit and addiction. And I know there's mood work we can do too, but my initial work is looking at the habit, looking at this pattern of behavior. And then the first step is actually the triple paradox, where
that's cool.
Like before we even look at changing this habit, let's work on understanding it. Would you be open to looking at what is it doing for you? How does it benefit you when you look at trying to fix your partner who's still drinking?
That's perfect.
Yeah, and they would really share a lot of deep things, right? And then we could tie it to their value system. It's not because someone's just being foolish. They're like, I care about this person so much. I'm desperate. I'm scared for their life. And so in that moment, I feel some sense of power,
So let me see if I get you, Thai-An. Instead of trying to help this codependent person change, we want to sell them on staying the same.
Yeah, exactly. And I've seen that to work so much better than any coming in of trying to use tools or wisdom or psychoeducate about like, oh, this is like an addiction, just like you were using alcohol or meth. We're looking at, why do you engage in this habit? Let's try to really understand the function of it. What is it doing for you? What does it show that you really value? And for the first time, often they're saying, I feel understood. The first time someone actually sees me as not someone who's just crazy, quote unquote, codependent, but I'm actually
flawed.
Flawed.
I have a question, but it's probably irrelevant. I should probably shut up because you're really cooking on all 8 cylinders right now. It's 600 horsepower. But I was talking to I think Matt and Mike Christensen and a few others, and I think one of the trends right now is to be using the exact same techniques with people who are hopeless and suicidal. Like the triple paradox and what does it show about you that's positive and awesome, rather than, desperately trying to control them or change them. But that's a topic for another day. But I was wondering if you'd come across that at all.
Yeah, I think anytime we can do paradoxical agenda setting, we're deeply empathizing with that person on another level.
Yeah, right.
And it feels more effective than just coming in and try to use tools to cheer them up or to share with them why they shouldn't be hopeless. It's like, let's understand the function of hopelessness, the cost of trying. It's risky. I risk failure, right? The function of hopelessness is I don't have to try anymore. I don't have to take risks. I don't have to hurt.
Yeah.
Yeah. And so the brilliance of team and paradoxical agenda setting is we could actually really deeply understand why this behavior is here, not in a shaming way that hurts them and that creates resistance, but in a way that deeply understands the function of that behavior.
Can we just give a brief example, because people are slow to understand, and what you're saying is so crystal clear, but I don't want it to go in one ear and out the other of people. So you're saying that it's a very stereotyped pattern that these people are in. They're living with somebody, pouring energy into that relationship, trying to change that person, trying to get that person to love me, and doing things that have failed 100% of the time on 1,000 occasions. With the zero success, and so to keep trying to change that person, or even for the therapist to change the patient, is just the same pattern as the patient is in with their lover or their wife or husband or partner or whatever. And you need to, first of all, learn how to empathize and be there with them in their suffering, so they can see that you're somebody who can and will support them without throwing this, what the Buddha called garbagey helping on people. And, or that might have been the Buddha's cousin who said that, I believe. but to be with the patient, and then when it comes to, you say to the patient, now, is there something here that you want help with? You've been suffering a lot, and they say, well, I'd really like to get out of this pattern. And then instead of taking the bait and try to help them get out of the pattern, which would trap them further in the pattern, but now it's your problem rather than their problem because you're trying so crazy to help them. You say, let's do a triple paradox and list three things in these three columns. And the first column would be, what does this helping and trying to save the other person from their alcoholism, or to make them love you, what does that show? What are some benefits to you in doing that? How does that reward you? And what are some of the rewards, Thai-An and Rhonda?
Well, it feels good to be needed.
Okay, so this other person needs you, so it gives you a kind of a morally superior role, because they're impaired and broken, and you're trying to help them. It gives you kind of a feeling of moral superiority, and also that they get kind of addicted to you. You can make them kind of dependent on you, just as you're dependent on them. I'm just trying to read what you're saying, Rhonda.
Yeah.
No, just like it feels good to eat a cookie. It feels good to take care of somebody else. I get it.
Feels good to feel important to them, and they say, like, you're the only person who's hung in there for me, or you really get me. I know for this client too, and several I've worked with, there's this sense of, in the moment, it feels worth it to feel some sense of control when I'm feeling so powerless, when I'm feeling so scared. In this moment, when I'm controlling or giving them resources or problem solving for them, or trying to help them and fix them, I feel some sense of control.
you feel you have some control over them,
Right.
because you're involved in this project together, and you're kind of engineering the project of changing them.
Mm-hmm.
And then, Thai-An, when you feel a sense of control over this other person, does it help you feel more control over your own life too?
Yeah, definitely. Some sense of control over them, the situation. I feel a little bit less anxious, at least for that moment. Right.
And does it also reward you that you feel like you're a rescuer, you're idealistic, you're trying to change someone who's broken, change the world?
Yeah. Everyone gives up on them, but I won't.
Yeah.
Right.
Yeah.
Everyone else is giving up on them, but I'm not going to give up on them.
Yeah.
Yeah. Well, wow, this is cool ass shit.
As the Buddha would say.
Yeah.
I agree with Vulgar Buddha.
Yeah. And then the second column in your triple paradox, Thai-An, would be, what are the disadvantages of getting out of this relationship? Is that what it would be? Or giving up on trying to fix and help them? What would they?
Yeah. If it was motivational interviewing, they would go to then the cost of staying in a relationship like this, right?
Yeah.
But in team,
did you mean to say horse shit motivational interviewing?
I want to say a more powerful and empathic way to approach it, I feel like, is actually aligning with what are the costs of letting this go.
Yeah, the whole motivational interviewing world is a great big codependent botch of crap. Right? You were saying that earlier, Thai-An.
Yeah, I think it serves its purpose in some way. And my preference is still like, let's really still align with the function of this behavior and validate that there are costs to letting it go. There are costs to stop.
Yes, exactly. Exactly. And what are some of those costs? I'll be alone. If I leave this relationship, I might get killed.
I'll be alone. A lot of
I won't be so important.
I'll have given up on the meaning of my life.
Yeah. And they may guilt trip me too, right? Like, oh, now you're going to leave me hanging too. Now you're going to be like everyone else.
Yeah, well, I'm just like everyone else, yeah. So that middle column, the disadvantages of change, the downside, we could have a good 5 or 10 very poignant, powerful, emotional things there. And then the third column, what does your codependency show about you that's positive and awesome and beautiful? Like what are, instead of, trying to change you for your codependency, let's praise your codependency. What does it show about you that's really kick-ass and awesome?
Yeah, and I love this column because I think it's so de-shaming, where I don't really see the good in you, even in this habit that feels maladaptive or appears very maladaptive. You could really see like the values of like, I value this person's life.
I value love.
I value connection. Perseverance and not giving up on people.
Oh, yes. And having healthy goals.
Yeah.
Yeah. And
right. I have dreams for this person to have recovery and sobriety in their life.
Yeah. And I'm there for him or her or whatever.
Yeah. I'm dependable. That's a big goal. That's a value for me. My partner can depend on me. I'm strong. I can carry their weight and my own weight.
Yeah.
Right.
Is that WAIT?
Yeah, right.
Because sometimes it's a long wait.
Yeah, you're right. Yeah, I love that.
Yes.
Okay, so cool. So then we've done this, and then what is the punchline here then, Thai-An? We've got all these 36 reasons to continue my codependency, and they're good, sound reasons. They're not paradoxical tricks. They're very real, powerful phenomenon. Then where do we go with that?
Yeah. Then we go to having them share why change, why work on this habit when it does serve you in so many ways, and there's so many costs to letting it go.
So are you saying then that the therapist can invite the patient to persuade me to work with you, as opposed to I'm going to persuade you, the therapist, I'm going to persuade you to change. Say I, the therapist, now that we've seen how this codependency is working with you, that you're going to have to persuade me. If you want me to work with you, you're going to have to persuade me to do that. And of course, what we've seen, and it is a paradox, is that when you do that, this person suddenly seems to change and really want to change and put effort into it. And I would say that maybe happens more than 90% of the time or 80% of the time, some very high success rate from that point of view. But of course, our readers, our listeners will want to ask the question, well, how about if the patient says, no, I don't want to change? What is the therapist going to say there? Yes, I love this role that I have as a codependent angel.
We say, let me help you. Let me make you want to. I'm just kidding.
I can help.
Yeah, what you're sharing, Dr. Burns, is when we're in a place where the client can take on the voice of change, it's so much more powerful when they say, yeah, but what I'm doing is not working.
Yeah.
Or I'm so exhausted.
I'm so miserable.
Yeah.
Yeah.
And they're the ones sharing the statements of why they need a change. And then what you're talking about as well is sitting with open hands, right? Because I have worked, I can think of clearly a young adult woman who I went through this whole process with, and she didn't take on a strong voice of change like the case example that I'm sharing. Because the case example that I'm sharing, I also have them rate 0 to 100. How motivated are you to change this pattern, 0 to 100? After the triple paradox, it may decrease some, but after they take on the voice of change to really answer why work on this, why change, it could be really powerful and increases their motivation to 80, 90% when they say it's no longer working. I'm not only not helping that person, I'm hurting my kids, I'm hurting myself. It really can boost their motivation. But I have seen it to where it doesn't. And that's when I think it's even more important to be paradoxical and really sit with open hands.
Oh, yeah, absolutely.
As an adult woman, I even said, I can see why you don't want to change this right now, because there's also something fun and exciting being in these relationships and the ups and downs and the chaos. She said for her, there's just something, I don't know if I want to change that. I still really like
see
that person.
That's what I mean when I say something in the therapist has to change before your patient can change. And a lot of therapists are in the same bag. They're not going to want to sit with open hands. They're not going to want to do a triple paradox. But that's a topic for another day, for our upcoming podcast called "Therapists Be Damned." Yeah.
And for the client that doesn't want to change, we just really have to honor and respect that, right? Like,
right.
Yeah, I don't know what's better for you right now, because maybe right now that function really works. It's more exciting. It's helping you to cope with something when you're in these kind of chaotic relationships. So
please work with me, Thai-An. Please, I want to change.
Well, that's better than Thai-An saying, you please work with, than Thai-An saying, please work with me. I see the chaos. I see the problems this is causing you, and I know how to change you.
Yeah.
I know how to fix you.
Yeah.
Let the client say that if they want it. They can say,
sure.
I have so much chaos in my life now.
Well, this is beautiful. Now we come to the M of methods, and I've certainly had some people after a triple paradox who didn't need any methods. They're so motivated, and they start to do their own changing in their own way. But a lot of people do need some guidance. So at that point, if we get into the M of methods, would you be using a daily mood log and helping them talk back to their self-critical thoughts? I can't be happy without him, and and if I don't have him, I'll have no one, and then I'll be alone, and work on the love addiction belief and all the steps in challenging a self-defeating belief? Or would you be working with a relationship journal, and what did he say and what did you say next, and make them aware of exactly the words they use over and over again that forces the other person to stay in the codependent relationship, these kind of crappy helping types of things. But so how do you segue into methods if needed, and which ones do you use? Because you mentioned some double standard cool thing you promised, Rhonda.
Yes, Thai-An previously was on the podcast, and she had talked about a variation of your double standard technique working with someone who was grieving the death of a loved one.
Yeah.
And that was beautifully done, Thai-An. And now Thai-An has adapted the double standard technique to work with someone who's coping with codependency.
Yeah.
So talk it to us.
And so the next step of methods, because I'm conceptualizing it as habits and addiction, I really look at the temptation of one moment in time to fix or to control or to help that person. And what are the thoughts that tempt you toward that habit? Right. And so we could do a variety of different tools around habits and addictions and changing it, like stimulus control, little steps for big feats, identifying the positive distortions. The devil's advocate could be helpful as well. And I've found this specific way of using the double standard to really allow them to see from a different lens. And it came from actually working in residential treatment, where I would see the addictions therapist say things like, what would you want for your daughter if they were in this kind of relationship? Right. But they didn't do any empathy or agenda setting. And so I think that just fell flat, or it feels kind of shaming. But now they're in this place where they're saying, hey, I really want to change. I want these tools. I want this habit to be different. I want these patterns to be different. Then I started to engage in this tool that Rhonda has actually named, because I said, Rhonda, I don't have a name for this. And she says, how about we call it the codependency double standard? And I just really love that because it honors team. It's simple. It's clear. And in this tool, we would look at the client as just themselves. But I would first ask, for example, if Rhonda was the client, I would say, is there a person in your life that you really love and care about? And I'll have them name somebody. And for example, a really good friend you love, a sister, a daughter, a mother, and they would identify that person.
So it wouldn't just be a partner. It could be a child or a sister or a friend or a brother.
Yeah. Just name someone that they love and really care about. But they're just themselves. And then they imagine if this person was in an exact relationship like the one you're in right now, or the one that you're thinking about getting into. Right? So if they named my daughter someone who I really love and care about, and then we would say, imagine now your daughter is like, we duplicated your partner, and your daughter is now in an exact same relationship, just like the one that you're in. And she's coming to you and she's sharing with you all of these really tempting thoughts. So it's very similar to the devil's advocate as well, right? But I think it hits on this emotional level that it just creates a different lens when they could see, oh, this is my dear best friend, or this is my daughter, my mother, who's in this exact relationship. And then they're coming to you sharing things like, oh, but in these moments I can have the hope of changing him. In these moments I feel some sense of control. I'm the only person who can see him. And so maybe this time I'll give the right resource. I'll do the right thing that could finally create the change, right? And so that's the setup, where then they're in this role where they're just seeing the person they really love, being in the exact same relationship, sharing with them these tempting thoughts.
Yeah.
And what would they say back to those?
Yeah, that's really, really brilliant and beautiful. And I guess what you're saying is in many cases, perhaps most cases, they have that healing voice within themselves, and they can apply it to someone else right away without any training or preparation. And it's a compassion based way of helping another person. And then does the punchline end up, and would you be willing to talk to yourself in the same way you're talking to your daughter or a dear friend? Is that where you'd go with it?
Right. If all of your statements are true for your loved one, are they all true for you as well? What is it like for you in this process to see that situation outside of yourself with someone?
And then do you also use other tools there? Because when something's working on the double standard level, do you ever see any value in going to externalization of voices to see if we can cement their ability to talk back to those tempting thoughts?
Mm-hmm. I haven't tried the externalization of voices with this, because it feels like that compassionate voice feels so strong already, but I think that could be a really powerful idea.
Well, yeah, you could check it out and see if it has value. I do it 100% of the time when I'm working, say, with someone who's depressed and anxious, because the double standard adds a certain oomph, that isn't necessarily present. Externalization of voices adds an oomph. You've got self-defense, acceptance paradox, and counterattack technique, be specific, and other methods as well. So you have a nice, a palette. And then in addition, sometimes I only find the double standard works for about 50% of people. And so some people just like a fiercer, more aggressive type of style. In fact, I think we saw that. I don't know if you were at the workshop on Friday, Rhonda, but we saw that with a woman there who we went from explain the distortions and offered her double standard or externalization of voices, and she wanted externalization of voices and really kind of hit the ball out of the park. Mm-hmm. But it's a beautiful framework, and the whole key to it is really acceptance of the patient, as opposed to getting codependent and adding yet another dimension and the infinite regression of people who were trying to help people who were trying to help people who were trying to help people.
Right.
Mm-hmm.
Is that right?
Exactly. And it feels really respectful of that person as well, right? It's your choice. It's your autonomy. I'm not going to force change on you unless you really want it.
Well, Thai-An, we only have about 10 minutes left. Do you want to do a role play? I'm sorry, David, I interrupted you.
Yeah, that would be a nice thing, Rhonda. Why don't you go ahead and set it up with Thai-An? I think that's wonderful.
Okay, so Thai-An, do you want me to be your client?
Yeah, that sounds great. Do you want me to use your name, Rhonda, or you want me to use...
Yeah.
Okay.
Yeah.
All right.
Otherwise, I get kind of confused.
Yeah, all right. Rhonda, so we're imagining you're in this pattern of being in relationships that you're just really focused on trying to help or fix, or that's quote-unquote codependent. And we've gotten through this space now where you're saying, I'm motivated. I really want to change this. It's painful. I'm suffering. I'm exhausted. And so we'll just go into this tool. And I'll say, Rhonda, I have this tool that has been helpful for people to just have a perspective on this pattern that can really help them begin to boost motivation to change, but also begin to have more clarity about the process too. I'm wondering if you feel open to trying out this tool and seeing where it goes for you.
Sure. Yeah, I'd love to.
Okay. So in this tool, I'd like you to think of a person that you really love and care about. And usually it's helpful, that it's like
any person in my life.
Another woman in your life who's also in a heterosexual relationship. And I know you've talked about it could be your daughter, your best friend, your mom.
Okay, how about my best friend?
Yeah. Okay, great. What's your best friend's name?
How about Janet?
Mm-hmm. Okay. So in this tool, I'm going to be Janet, and you're just
okay.
yourself. You're my dear friend, but I'm Janet, and I'm actually in an exact same relationship as the one that you are in. So imagine we just duplicated your partner, and I'm in that exact same relationship. And I'm going to share with you all of these tempting thoughts that we've already mapped out on the habits log. And then as I share them with you, your role is just to respond to me as you see me, as you see Janet, a person you really love and care about. I'm your best friend. And it's helpful that, you respond to me as a friend with compassion, but also with honesty.
Okay.
Yeah. And I'm wondering how that feels like for you. Do you have any questions?
So Janet, my best friend, is in the same type of relationship that I am with Mark, the guy that I'm involved with now.
Yeah. And like if Mark had an exact twin.
Okay. So Janet's involved with Mark's twin.
Yeah. Who's exactly like him in every single way.
Okay.
And we're in the exact same dynamic.
Okay. Got it. Okay. Understood.
Yeah. Yeah. You feel open to jumping into this?
Totally. Yeah, sure.
All right.
That makes sense.
I really appreciate your hard work and diving into this process. And so, okay, I'm now Janet. Rhonda, can I talk to you for a minute?
Oh, sure. Janet, it's great to see you.
It's always great to see you. I always appreciate you as a friend who's been compassionate with me, and also just, you tell it how it is to me, and I always appreciate that from you. And my relationship too with Mark, and I just love him so much.
Yeah.
But
I love my Mark too.
Yeah.
Yeah.
Yeah, you get it. And it's just so challenging. And in these moments where I'm thinking about change, I just also think it feels so good when he tells me man, you're the only one who continues to stay there for me. And I just love you so much for that. What do you think about that?
Well, I think that's, I think that's actually kind of impossible. It kind of fits into the category of always or never. Like, how could I really be the only person in his whole entire life, now and forever, that really understands him? I think that's a way of him hooking in to you. Well, to you. Like, how can he be the only person?
Oh, yeah.
I'm sorry, how could you be the only person that understands him? Is that it?
Yeah, I see that. You're saying it's almost like he's hooking me in when he says you're the only one there for me and you're the only one who gets me.
Yeah.
Yeah, I
just feels like that's kind of an impossible relationship quality.
Yeah. And also, there's these moments where he's drinking again and I'm feeling so helpless, but it actually feels like in the moment when I'm trying to give him a solution and I give him another resource, I'm thinking, this is it. This is the time that he'll change. I finally found now the right treatment center, the right therapist. And this is the moment that it's going to really help him because I just, really want him in recovery.
Wow. Well, him drinking again is kind of scary, and drinking so much that you want him to be in recovery. It sounds pretty unhealthy of a relationship for you to be in. And Janet, you have a lot of experience because you're an alcohol and substance abuse counselor, and you can't bring someone to want to change. That's something that they really have to do themselves. They have to want to choose to give up their substances. And it sounds like you've done a really great job of finding them a bunch of resources, but until they choose one, there's nothing else you can do.
Yeah.
As sad as that is.
Yeah. And Rhonda, I'm wondering if it's okay for us to pause here and to step out of this role play and just foresee, like, what was that like for you to see me as Janet, your best friend, being in an exact same relationship as you?
Yeah, I felt really protective of you and loyal toward you, and kind of sad that it seems like you're kind of suffering in this relationship. That's kind of yucky. I want you to be happier.
Yeah. And I'm wondering if all the truths you shared with me, what that's like. How did that land for you when you look at those statements? And what's that
Well,
like?
it feels really easy to say that to you.
Yeah.
It feels easy to say that to you.
Do those truths apply to your situation as well?
Well, I kind of don't want them to, because it feels good to be in this relationship and I don't want to be alone. But then again, it does apply to me, because I can't control somebody if they choose to get into recovery or not. I know that, and I totally know that. And it's ridiculous to think that I am the only person in the universe that could really understand him. That's just so...
Yeah.
Actually feels really manipulative on his part, and it doesn't feel good to be on the receiving end of that. So I think they both apply to me.
Yeah. And of course, you don't want to be alone. And I'm hearing you're also saying these truths apply to you.
Yeah.
What's it like to sit with that in that perspective as you see it objectively in Janet's life and applying it to yourself?
Well, I haven't been in a relationship before I met Mark, I wasn't in a relationship for about 5 or 6 years, and I did fine on my own. I had moments of being lonely, but I had a lot of friends to hang out with, and I have my kids. So I think it would probably be better for me to be alone again. And that could open up space for me to get into a healthier relationship with someone who wasn't drinking at all.
Yeah. So now I cured Rhonda.
Yeah.
The therapy was successful.
I know. I'm thinking, I don't want to be in a relationship with a manipulative drinker. I would rather be alone. Yeah.
Right. And this is the space where we could bring in a lot of other different tools.
Yeah.
Right. We could then do problem solution. We can honor the parts that are really going to grieve and even going to miss him.
Yeah.
Maybe temptations to go back in. So we could really work with all of that as we anticipate relapse and really normalize that whole process too. But lots of different other tools we can use with them to support that journey.
Wow, Thai-An, that was really powerful.
Yeah, what was that like for you, Rhonda, in the role play?
Honestly, the pronouns in the first example were a little difficult. I forgot what pronoun to use and who was saying what to who. But I still got the message. And then the second thought that you gave to me was much easier to respond to. Yeah.
Right. And I think it's more complex because you're also playing the role of someone else. But when it's the client, they know it's them and they know they're envisioning their daughter or their sister being in an exact same relationship. And already I feel like this isn't right. I already feel so protective. I could see it more objectively. I just want so much better for them.
Yeah. Right. Because you're choosing someone that I really love, that I really care about.
Yeah, exactly. So, so that's a wrap of Team CBT for codependency.
Well, you guys did a great job on your role play there. I thought really brought it to life, and I thought your whole approach reminded me in style, not in content, because we're in a different universe now from then. But Sterling Morey,
wow, how flattering!
Yeah, and he had that same gentle. Take it step by step, showing kindness at every step of the way, and walking us through really how to work with someone who's struggling with codependency, and again words don't have any correct meaning. It's just the way we're using them. And we're using codependency to mean two things, really. One is the fear of leaving a relationship because I need love, and there at least I can get some morsels of love from time to time in this relationship, and the fear of being alone. That's one of the huge dimensions. And then the other dimension is this person needs me, and I can fix her or fix him. And that's an addiction. I guess both of those are addictions. One is an addiction to love, and one is an addiction to helping. But what you've shown us is a totally paradoxical approach based on team, where instead of trying to help and change the patient, we're honoring the patient, both with empathy to see the patient's suffering, which is tremendous. They'll be depressed, anxious, guilty, ashamed, inadequate, alone, lonely, feel rejected, hopeless, frustrated, angry, humiliated, embarrassed, all of that in large doses. And then when we go on to paradoxical agenda setting, instead of jumping in there to try to help or change the patient, we use techniques that help the patient not be ashamed of their symptoms and problems, but proud of them, and to see what's beautiful about their codependency. And then the paradox there is that the moment the patient. Thank you, Melanie. Yeah, awesome. My wife just brought me 2 beautiful sandwiches.
Oh, goody.
The cheese and tomato toasted. But the moment the patient becomes proud of their symptoms instead of ashamed, then you've got a real connection with them. And then they have to talk you into working with them, not you talking them into changing. So it's a totally paradoxical approach from this very start to the end, and it's a beautiful, gentle approach. What is your kind of failure rate with this approach? Which is unfair to ask. I could ask what's your success rate, but I can imagine this is working with a good 60, 70, 80, 90% of the people who you're working with.
Yeah, I think it's an ongoing process in how we identify success too.
Yeah.
Because of course we do see, like any habit, there's temptations to go back. And it's not about do you fall off the wagon, it's how do we come back from it. And to me, that's still success when you're still on the journey of working on healing and shifting patterns. We may work with some trauma that leads them to engaging in that pattern or some of those deeper beliefs, right? But when we've gone through the Team CBT process and they're motivated to change, I would say it has a really high success rate, like overall 80 to 90% or so. I can really only think of that one young adult lady who's like, I really don't want to change. And then then let her go.
And then we sit with open hands. Mm-hmm. They are free to come back if they ever change their mind.
Right. Mm-hmm. But when they're ready and they're aligned with, like, they feel we're aligned with their resistance, we're not shaming them about it, and it's okay for them to relapse and to come back and to keep changing. I still see that as a success in doing this work together.
Well, thank you, Thai-An, for hitting the ball out of the park again. You're like Barry Bonds of psychotherapy. Every time you come up to the plate, you knock it out. You hit a home run. But it was Taylor's that way too, Rhonda, I think.
She is, absolutely.
Yeah, it's just simple stuff presented in clear, gentle way, but it's not the kind of stuff that anyone would have thought of, really. Mm-hmm. It's so anti-intuitive. Mm-hmm. And you've just done a beautiful job, Thai-An. Thank you for that. And Rhonda, you've done a really beautiful job as well. And I'm so glad that you came up with this as a great idea for for a podcast, because it certainly has been an excellent one. It's to my way of thinking.
Yeah. It was actually Thai-An's idea. I just asked Thai-An what she wanted to talk about because she said it's a pleasure to have.
Yeah.
And also want to remind the listeners that the podcast you did on grief, Thai-An, was episode 344, in case people want to listen to both of these. But thank you, David. I appreciate your praise and your stroking both for me and Thai-An.
Yeah.
And we want to thank you for creating the model that brings 80 to 90% success to our clients.
Yeah, I'm just so lucky to have awesome, brilliant people like you taking the model and showing how it can really work and come to life to change the lives of people who are suffering, all different kinds of suffering.
Yeah,
absolutely.
And that's certainly one of the severe ones in our society is the codependency. There's a lot of stuff that's worse in the world now as the world goes to hell in a handbasket or whatever they say. And we see all these horrible things happening all over the world, including in our own country. But certainly in the world of mental health and mental suffering, codependency is a great big theme, and even in parent-child relationships as well. And we're never going to be out of business because the world is very slow to learn, unfortunately.
Mm-hmm. Yeah, I want to thank both of you as well. And I feel like TEAM-CBT has changed my life, and anything else that I've learned, TEAM-CBT just makes it better. And so I'm grateful to have brilliant teachers, to know this model, to learn from both of you. We learn so much.
Keep on doing your amazing work. Now, do you have any classes you're teaching that you want to attract students to coming up, or?
Yeah, I don't think so, since this is released in March. Yeah, I don't really have anything that's released around that time to share. But if
Thai-An is one of the world's top teachers of TEAM-CBT and whatever she'd want to teach. So do go to your website and look for classes if you're looking for help, and you're in Oklahoma City or virtual, I guess. Do you work all over the United States?
Yeah, for my trainings, people can reach me.
How about for your clinical work?
My clinical work is still tied to Oklahomans only.
Okay, due to licensure issues,
They have to be physically present in Oklahoma for me to work.
They have to be physically present in Oklahoma? You can't do virtual work?
Yeah. For my LPC license.
Oh no, they can be it can be virtual as long as they're somewhere within the state of Oklahoma, right, Thai-An?
Oh, okay.
Physically reside in Oklahoma.
Yeah, cool. Mm-hmm. So if you're looking for some help with your own emotional issues in the area of depression or anxiety or relationship issues, Thai-An you're in Oklahoma. Thai-An is your lady, and if you're looking for some great training and you're anywhere in the United States or extending to outer Mongolia now, the teaching is virtual, so you take people from all over the world, really.
Yeah, and they can just go onto my website to access any of my courses or upcoming ones.
And what is the website again?
Yeah, it's just TEAM-CBT-Training.com.
TEAM-CBT Training, all one word, .com. And there you'll find magic awaiting you. So thank you. Thank you, all of you for listening and tuning in. We love you, and thank both of you for being your wonderful selves. Amazing.
Thank you, David.
Thank you for having me.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.